Hey everybody, how you doing? This is Dr. Tom Iannello from the North Isle Wellness Center in Miller Place. I'm sitting here with Tunde. Did I say it right, Tunde?
Yes.
Okay. And Tunde and I had the pleasure of meeting about, I don't know, like a month ago at the Naval Expo,
about
right?
a month ago.
And Tunde had come in with her boyfriend Greg, and they wanted to work on some health issues. So specifically, Tunde, what brought you in here?
I was suffering for 6 months already with horrible migraines,
Okay.
which lasted for days.
Sorry.
And I also had knee pain for a couple of months.
Okay.
And nothing really helped permanently.
What had you done before you got here to try to take care of the headaches and the knee pain?
Okay, so with the headache, I was very desperate, so I went to the medical doctor and I got a painkiller, but I didn't want to leave on painkiller. I went to acupuncturist who worked on me and chiropractor, but nothing really helped permanently. It was keep coming back every month.
Got it.
And the knee is actually, it started in January with after overworking with in dance, but what I tried with that is also chiropractor and cord laser, which helped a little bit, but it was keep coming back, and I didn't understand why it just doesn't disappear, why it just doesn't go away.
So let me just get you guys up on how she lives. So she's very physically active, she's very physically fit, right? You love to dance competitively, right? So this is not the case of somebody who has not taking care of herself. She's taking care of herself, and she even followed a very good holistic protocol with excellent practitioners, I'm sure. So the question remains, why would you be treating the knees and the different parts of the body and the head area, and why wouldn't it respond? So we did our examination on you, and what we found very simply is that her adrenal system was under stress, and it just needed nutrition to bring it back up. So basically, in a nutshell, your body was fatigued. What we found with her knees is that she just wanted support nutrition for her knees. Her knees were not pathologically damaged. There was no tearing in the tissue. They were just missing the proper nutrition. And until we put in the proper nutrition, the knees didn't start to really change. Now, what happened since you started taking your nutrition? Now, it's been only 3 weeks, right?
Yes.
So it's only 3 weeks.
3 weeks ago.
So what happened?
Okay, so I changed, first of all, I changed my diet, only protein and vegetables.
Very smart.
No sugar. No carbohydrate.
Thumbs up, baby.
Yeah, it's like an instant energy right away. And then
you lost 5 pounds.
And I lost 5 pounds.
You forgot to mention that you lost 5 pounds.
Yes,
now listen,
I did that too.
Listen, she's already in shape. She didn't really need to lose 5 pounds, but she probably pulled off all those little extra steps. There you go. So she's nice and firm. Go ahead. So 5 pounds is off just eating properly.
Right.
Well done.
And then I started to take the supplements, what Dr. Iannello prescribed. It's like 3 kind of different supplements. And I was very enthusiastic to start. I couldn't wait because I couldn't wait for all this pain to go away. I couldn't live like this. I used to be an energetic, no pain, pain-free person.
You can kind of tell she's enthusiastic.
Yes. So when I started to take the supplement, after 3 days, I didn't feel any pain in my knee. So I couldn't believe that it's the supplement. So I challenged it.
How?
I did extra work, extra hard, dense moves, which I couldn't do for months, and which actually caused my knee pain to begin with. And I was expecting in the next morning, I'm gonna wake up with pain and sore muscles, and was nothing. So I was keep taking it, and then I was also able to go just recently back to gym and do bicycle, and it didn't really hurt anymore either. And I'm doing yoga too, and I'm back to like 3 years ago, 4 years ago, to yoga poses, which I couldn't do because of my knee. And
so that means your flexibility is increased.
And my flexibility increased. And I forgot to tell you though, that even though if my knee was doing better, I just generally felt stiff. Like if I stayed in one position.
So not even just your knee, but your whole body?
And then the whole body. I get up from certain position, and I was very upset about that. I'm like, what am I, 89-year-old? You know, and I'm active, and I feel this stiff. And now that stiffness is gone too. But and most importantly, my headache, which I was every month, I was afraid, when am I gonna get? When am I gonna get the headache? The headache, the migraines were like very severe for me. 2-3 days, nothing helped. And this past month, none at all.
Fantastic.
Not even a slice little headache which just would give me like.
So curiously now,
brain
so
fart.
here you are now, we're at this point, right? So being that you feel this good, are you concerned about your health going forward, being that you know you can feel this good in just a very short period of time with the proper evaluation?
Well, what did you say?
So in other words, being that you feel this good
Yes.
and you're doing very well, are
Yes.
you concerned that there's something that you won't be able to fix going forward if
No.
your body?
No.
That's the
Because
point.
I have you can test
well,
everything.
that's very sweet. So my point is, see, now that's interesting because this is a woman that already took care of herself. You know, she's very athletic, she's very health conscious, she eats a specific way. You know, I mean, she's already doing the right things, and even when you're doing the right things, if something is missing,
happens.
you know, things can start to break down, and you think you're getting
Yeah.
old, and it's not. It's just simple things that when you put them in, all of a sudden, the body just takes off. And I mean, she
Exactly.
took off like a firecracker because she just blew right through all her problems in a couple of weeks.
And after actually 1 week later, and now I have constant energy, thank God. I'm back to 3-4 years ago, and with my knees back to 5 years ago. And
So
I
you got
just,
a little younger, didn't you?
Yes. I got 10 years younger now.
Right. That's fantastic.
And
So
that's what
great
I
to
was
hear.
very sorry and upset about feeling, because
Yeah.
I felt like I'm getting old, I'm getting sick, and
Yeah.
why?
Right. The why.
Yes.
And once you figure out what's wrong and you fix it, you stop worrying about all that because you've corrected those problems now. So now really you can do whatever you want with this body. All you have to do is feed it. And we
Yeah.
now figured all that out. So I congratulate you on a great job.
Thank
I'm
you.
so proud of you.
Thank you
She's
for
going
your
to do
help.
great. She's doing terrific, and I know we'll hear even better things from Tunde in the future. I can't wait to see how well she does when she finishes
Next
up.
time I'm going to look 10 years younger.
All right, I love it. We'll talk to you soon. Thank you, Tunde. Good
You're
job.